Welcome back to Families in Action right here on KHTS, AM 1220, your hometown station. And today, here with Cary Quashen as our host, we are talking about September being Recovery Month. Cary, listen to this. A couple of things to bring us into this. This is the 26th year for Recovery Month.
Awesome.
And this year's theme is Join the Voices for Recovery, Visible, Vocal, Valuable. And here, listen to this. Now, this is shocking. Maybe not to you, but to me it is.
You know, when I recited, nothing shocks me anymore.
I know, you've heard so many.
It just don't shock me.
You've heard so much of this with respect to recovery. But listen, this also is not just chemical dependency, but also mental health.
Right.
Right? But together, during this time, we can help, listen to this, 22 million Americans with addiction. And
22 million people with addiction.
23 million more in recovery, with 350 lives lost each day. And you say we're not in a war?
350 lives a day. Now, we're just talking about, that's like overdoses, right?
That's
Or is that including car crashes and everything?
No. This is relative to chemical dependency and in mental health issues.
So then you add car crashes and other reckless stuff that happens because of the number goes way up.
22 million Americans with addiction and 23 million more in recovery.
So let's hide our heads in the sand. The Nile's a river in Egypt, right?
Wow.
Or
Yes,
not?
it is.
So we have to start paying attention to what's going on around us. We have to get our heads out of the sand. We have to start doing what we do great here in Santa Clarita, and that's talk about what's going on. We have to not live in fear. We not have to hide, you know. And I'll tell you one thing that I found out a long time ago. We're as sick as our secrets.
You know what? That, I have to say this then. You just said the perfect thing. 90% of those who need treatment don't get it.
Because they don't talk about it. They don't let anyone know what's going on. They're too afraid to talk about it. You know how many families that I deal with where husband or wife or whatever, mom or dad, they don't leave the house. They're so afraid. They don't tell anybody. And now you get somebody that's addicted to drugs or alcohol, and then you get everybody else that is just dying at home watching it happen.
And I think this is a quote from you. There is no one in this country who can say that they don't know someone who has been affected by addiction.
No. I really absolutely believe that. I don't believe that I know anybody that doesn't know somebody in trouble.
Addiction is the most ignored health crisis in the nation.
And I'll tell you what, it's getting pretty hard to say it's not a crisis right now. It's getting pretty hard. It's getting very difficult to say we're not having an epidemic right now.
I'd have to say the lump under the rug would be pretty tall,
In
wouldn't
fact,
you?
I think the White House said we're in an epidemic now.
Hello.
So the federal government has acknowledged the fact that we are in crisis right now when it comes to prescription medication.
Take those to
And
Henry Mayo
heroin.
this Saturday.
Take the Henry Mayo this Saturday. And not only are we in crisis with prescription medications, and they say we're in a crisis with heroin, I don't think I ever met anyone that woke up one day and said, I'm going to use heroin. All drug abuse starts innocently. Can end up tragically, but starts innocently. Do we have a call? I believe Stephanie was going to call in. She's our producer and was actually the first host with me on this show. So let me see if we can bring her in. I think she's in Texas. Let's see if I can find her. Stephanie, are you on the line?
I am on the line. Hi, guys.
One
How
of
are
my
you?
favorite people in the world.
Hello, Stephanie. It's Mike.
An important topic you're talking about today, and let me tell you why. Cary, you know I've been working with Action one way or the other for 16 years now.
Right.
We first walked into a parent-teen support group when our kid, who's now an adult, was then using. I then went back to school after being inspired by your counselors and the education and the advocacy that's so important to the world about recovery. I went back to school and became a certified addiction specialist.
You did, which I was super impressed with.
Don't be impressed. It needed to happen for a number of reasons, but part of the advocacy issue for me was the reason, because when you talk about those issues of advocacy and talk about the importance of a recovery month and that recovery conversation, we talk about prevention working. We talk about treatment as being effective, and we know that people recover because when you're sitting out there as a parent of a loved one, I don't care how old your kid is, whether he's 10, 12, 14, 18, 20, 24, 34, 54, and your kid is an addict and they're not in recovery, it's those people who have recovered and who've become healthy and who spread the message that there is hope makes a difference to the family.
Absolutely.
It makes a difference to the agencies who treat people, and it allows us to see that recovery is possible. But it's not just recovery for that addict either, and that's the other part of that recovery message that's so important, is that family members, husbands, wives, moms, dads, brothers and sisters, have to come alongside their addict and also recover.
Yeah. And it really is a family disease when it comes to addiction. It's not just the person using. At Action, we treat the identified patient, but to us, the identified patient's everybody. It's because if you just take Michael, for instance, and we bring him into treatment and we fix him up and we send him home and everybody's doing the same stuff, he's in trouble.
Right.
So everybody's got to work on it. Everybody's got to make a change. Everybody's got to get involved in it. And I hear so many people say, it's not my problem, it's my kid's problem. He's your kid. Yes, it's your problem.
But it's all of our problem, because we tend to take if you're a diabetic, if you have cancer, if you have multiple sclerosis, if you have some other kind of horrible, God forbid, disease, we as a society wrap a pink ribbon literally around those diseases for hope.
Right.
You know, the pink ribbon is a symbol of hope for women with cancer, for example, and that spreads the message. Nobody is out there wrapping a ribbon of hope around addiction. As a matter of fact, many people are treating it as a disease of moral turpitude, which is not the case. It is a disease, and it has a function that happens inside our brain that continues to affect not only that addict, but everybody else around them and everything that they do. And the problem is that too many people are still unaware that prevention works, and that whether it be mental health issues or substance abuse issues or disorders, that can be treated just like other problems, and that's where we lose that whole process. So the importance of Recovery Month is the fact that people rise to the occasion and tell their stories publicly so that other people can come alongside and say, you got through this, I can and will too.
Right. You know, the scary thing about treatment too is in Recovery Month, surveys say, and I'm not big on surveys because, you know, they only survey a certain amount of people and who knows what's really happening. But surveys say the normal alcoholic or addict has to go to treatment 7 times before they get it. Now, I own treatment centers, and I don't know that I agree with that. I've seen people come in once and get it, twice, maybe 3 times, or who knows what they do when they leave. But I guess where I'm going is, well, you never give up. You never know when that one time is going to work. But more than that is, if you're living with an alcoholic or addict, and you can help me with this, Steph or Mike, is you got to take care of yourself first. If you don't take care of yourself, you're no good for anybody else. So when somebody that you love is in trouble, the first thing you got to do is make sure you're okay. So you're strong enough to be able to do whatever it is that you need to do. Yes?
We were talking about this with the show we did on codependency.
But that's really what it is. There's a lot of codependency going on. The addicts or the alcoholics addicted to the alcohol or whatever. We're addicted to them. And a lot of times we want to be the martyr, so we're stuck in keeping the person sick, so we can be the whatever, you know.
Well, and oftentimes the analogy the 2 analogies that are used is, you know, if you fall off a boat, somebody throws you a life raft, okay, and so they throw you that life ring, if you will, or that life raft, so that they're not going in after you, jeopardizing their life. Or when you're in the airplane, it's the classic example of when the oxygen mask drops. If it does, put yours on first before you put yours on your child.
Correct.
So that you can be functional enough to take care of that individual, whether it be a child or a senior citizen or even, a spouse sitting next to you, that you're functional enough to make good decisions to then help in that situation, and that means keeping yourself healthy, which is part of what that movement's been about, is talking about addiction to bring it home that it is a reality and it is something that can be taken care of and can be treated.
Yeah, when silence is broken and people start talking, things can get better. Until that, things are broken. If everybody's silent, how do you fix it? You can't. So it's kind of be one of those kind of things where we have to talk about it, and everybody's like, we've talked about in mental health too. I mean, we live in that, and we got that shame-based thing. It's like, oh my God, we can't talk about this. What are people going to think? And I was talking to someone the other day, kind of somebody that's important in this community, and I deal with this all the time, saying, oh my, I can't go. People will see me. Well, wait a minute. If anybody sees you there, they're there for the same reason. And we have nothing to be ashamed about. I mean, when somebody comes, I was talking to another parent last week, right, and says, and I deal with this all the time, I feel like I'm a loser being in this room. Well, maybe you're a winner being in this room.
I would definitely agree with the winner.
Yeah.
Absolutely.
Maybe the losers are the ones who won't come. Or somebody saying, I can't believe somebody saying, I can't believe I need help. Well, big part of getting help is asking for it. And the rest is go ahead.
What's interesting, Cary, is that nobody says, I feel ashamed that I have cancer.
Right.
No, nobody says, I feel ashamed that I have, a multiple sclerosis, or that I have a kidney disease, or I have diabetes. That's not what's said. Or nobody says, gee, I feel guilty that I have those diseases. And guilt, as you know, and I've learned from you over and over again, that guilt keeps all of us helpless, hopeless, and stuck.
Right.
But when we add shame to a disease, that paralyzes us.
That's where you find suicide and all the other stuff that comes along with it. So many people, they get so helpless and hopeless that they just give up. And it's like, wait a minute. There's treatment. There's hope. There's ways to deal with this thing. You don't have to do it alone. You don't have to be ashamed. And you surely don't have to be afraid to ask for help.
Well, that's why this year's theme for Recovery Month is important, because it's visible, vocal, and valuable, and it highlights peer support. Peer support is crucial in people getting in recovery, but it's also crucial in educating and mentoring and helping others. And I was first drawn to action, as I said, because I had a kid who's an addict, and that was the place in life we were at. But what I learned more than anything was that I needed to come alongside, and we needed as a community to learn as much as we could about addiction. And it's just not the community of Santa Clarita, it's every community in the United States, big or small.
Stephanie, you hit the nail on the head when what you just said, because
she gets lucky sometimes.
She does, yeah. Often individuals who experience a mental and or substance abuse disorder feel isolated and alone. And support from peers is essential to recovery.
Alcohol and drug abuse, or let me change that. Alcohol and drug addiction is a disease of loneliness and misery. You could be in a room with 3,000 people and feel completely alone. You could be lying in bed with your husband or wife feeling completely alone. You can be lying in bed alone feeling completely alone. I mean, any way you look at it, you're alone. And until you reach out and find a way to fill that hole, and the only way you're going to do that is by getting some kind of help.
What does it look like, Cary, for somebody? I mean, fear keeps people from going forward a lot of times. Suppose somebody's out there listening right now, and it's either them or someone they know, someone they love. What happens in recovery?
Well, it's such a frightening thing. First of all, an alcoholic or an addict, in the beginning stages, they always say this: I could stop whenever I want to. And that goes on for years. Then, when it becomes the middle stages, I can always stop whenever I want, but they know they can't. It's one of those kind of things where, I better ask for help soon. So I know I'm now not kidding. Now I'm not even kidding myself. They know. As it gets later stages, it's one of those, I can't stop no matter what. They don't see any hope whatsoever. They have no way to figure out how to do this. It's completely them against the world. They're alone, isolated in the middle of an island kind of deal. So until somebody throws them, like Stephanie said earlier, some kind of a life vest or something that'll give them a little bit of hope, they don't know what to do. And by the way, people don't change until they have to. If alcohol and drugs is still working, they're not going to change. If it still makes them feel good and solves whatever it is that it's solving, they're going to continue to do that. People change when alcohol and drugs stop working, when their brain don't turn off, when it's not making them feel lonely and miserable, when it's making them feel worse, or when they get arrested or somebody's going to leave them, or there's some kind of life-shattering event. That's the bottom that people talk about.
Well, if you were going to take away the fear, Cary, what would you say about getting help?
Pretty simple. You got nothing to lose and everything to gain. What in the world do you have to lose? You're already feeling isolated. You're already feeling alone, probably suicidal, depressed. You have nothing left to look forward to except for misery. By asking for help, I guess you got everything to gain and nothing to lose. So what's the fear about? And I know what the fear is about. The fear is usually this: I probably can't do it anyways. People do it every day. People that said to themselves, I can't do this, no way, no how, do it every day.
So you see it.
Cary, you've been clean and sober for how many years now? 36?
Going on 35 on Christmas Eve.
35? Christmas Eve?
And I said the same thing. I'm going to tell you, 35 years ago, I was sitting in a single apartment in Hollywood on the 3rd floor. I had a German Shepherd, a mattress on the floor, a lowrider car, and a gun. And my plan was to pull the trigger because I didn't see any way to stay clean. My God, am I glad I didn't do that.
But you just said a great thing.
What was the turning point for you?
You just said a great thing, Cary, because people could sit out there and
I don't usually tell my story, but
right,
I figured it fits.
I know, but it was good that Stephanie asked you, because
I'll get even, Steph.
People listening to this show every Monday, after a while could say, he sounds like he's got it all together, so he couldn't have been too bad off.
Oh, I was pretty bad.
You're pretty bad off.
Yeah, I mean, I could tell you this, that my bottom was pretty horrible, and not so much all the legal stuff which I had, not so much all that, but the loneliness and the misery that drug addiction causes.
And people should understand that you're not saying this to brag or boast that you got help. Good heavens.
No.
You went through what they're going through.
Exactly. I mean, I remember walking into a treatment center almost 35 years ago saying, okay, maybe now somebody's going to save me. It took me about a minute to figure out they weren't going to save me. It was
you who was going to save you.
I had to sit in there. They put me in a safe place. Now I had to do the work. So, I almost lost hope for about a minute, but I figured, look at there's people here that's been here a week, and they're clean. If they can do it, why can't I?
Cary, how old were you when you started using?
Oh, gosh. I started using drugs probably when I was about 12, 13. Mm-hmm. And stopped at 25.
Why did you start?
Mm-hmm.
It's one of those kind of things I said I never, ever would. But, you're hanging around with these cool kids and you get desensitized, and before you know it, oops. That's why I say drug abuse always starts innocently. And it can end drastically. And we start breaking our contracts and doing the things we said we would never do. But what I found out is, what? People recover all the time. If they can do it, so can I. If I can do it, so can you. So if I can do it, anyone listening can do it too. You just got to want to. A lot of people need it. You're not going to get it unless you want it. So if you want it, you will get it. That's a fact.
And where can they find help?
Well, call us, 1-800-367-8336. It's 1-800-367-8336. If we can't help you, we'll find someone that can.
That's
what we do.
That's the thing. You guys do that.
Yeah, or you can go to your local clergy. You can pick up your insurance card. On the back, it says behavioral health. Call that number. You know, there's a lot of other places. If action isn't it, I mean, call the Child and Family Center. There's places all around that you can just call somebody. Do something. I like that old share unit or whatever, care unit. If you don't get help over here, call someone else. Just get help. And that's what I mean.
And what about families, Cary? Let's talk about that, because families can, even if they have a loved one who chooses not to become clean and sober for a particular minute or moment or time, and sometimes it's years, sometimes it's a short period of time. Let's talk about what families can do, because your staff is available to direct family members to places that are helpful.
Right. Well, we only have about a minute left because our format changed, but I do want to say this is do everything you can. At the end of the day, if you can go to sleep saying, I did everything I can, now it's up to them, you can go to sleep feeling good about yourself. That doesn't mean it's going to feel good watching what's going on with your loved one, but at least you know you've done everything you can do. And that's a big deal. That's a big deal. And there's lots of programs for families. You got Action up here. That's every Tuesday night at Canyon High School. There's Al-Anon. There's Nar-Anon. I mean, you name it, it's out there. So there's a lot. There's NAMI. There's all kinds of different places and programs. So, Mike, what does this go to?
What's that?
What time are we done here? I want to make sure we don't go over.
We got a little bit of time left, but you know what? We don't want people to leave us. We want them to stay with us because, for one thing, before we go away, we are going to make a very powerful announcement that they need to listen to. Is it time for a break?
Stay with us, Stephanie. This is Families in Action on our hometown station, AM 1220 KHTS.
Welcome back to Families in Action right here on KHTS, AM 1220, your hometown station, with your host, Cary Quashen. Today, we are talking about September being Recovery Month. Recovery Month, Cary.
It's exciting stuff. We've come a long way as a society to have a month just designated for that, for Recovery Month, when it used to be we didn't talk about it.
You know what we have, Cary, but 1 month and 1 day, as you and I have always talked about, as we pulled the show together, doesn't talk about it. It's got to be an ongoing dialogue, and you've started it once again today, and there'll be somebody whose heart is tickled with the conversation and go, golly gee, I know somebody who needs help, or golly gee, I'm a family member who needs help, and that's what joining the Voices of Recovery is all about.
Well, I'll make you guys a promise. I'll be here next week talking about it again. So we're going to keep talking about it, Steph.
And hey, Cary, we got to mention for anybody that just tuned in, we are talking on the phone with Stephanie down there in the Lone Star State. She called us up.
That's right. And Stephanie does a lot to help us with this show. She actually helps produce it and guests and everything else.
She gives me all the spiffy stuff to say. See, I can't even speak. That's Stephanie's fault, by the way.
It's Stephanie's fault. Just blame Stephanie. She's in Texas. Hey, Stephanie, what's going on Saturday?
What's going on Saturday is Drug Take-Back Day, an important day in the community to go through your cabinets, take back those old prescriptions and those things that are no longer needed, take them back and get rid of them, A, so your kids don't find them in your cabinet, B, because it's outdated medication, C, because it doesn't have a place in the trash can or going down the toilet. It needs to be disposed of right there in Santa Clarita at Drug Take-Back Day.
Very cool. Wasn't that cool?
I think that's cool. And, if you want to meet Cary, Cary's going to be there.
I will be there.
Cary's going to be there. And, by the way, that's this coming Saturday.
At Henry Mayo Hospital.
At Henry Mayo, you can't lose here. Listen to this. Action Family Counseling in conjunction with KHTS AM 1220, the Santa Clarita Sheriff's Station, and Henry Mayo Newhall Hospital, all banding together for the 3rd annual SCV Drug Take-Back Day, Saturday, September 26, 10 a.m. to 2 p.m. It's anonymous. You don't even get out of your car. You just drive by and throw those bad boys into the container.
And we will get rid of them in a responsible way. We won't. The DEA will.
That's right.
And nobody will end up getting in trouble with those drugs.
Clean out those medicine cabinets.
Clean out those medicine cabinets. Make room for what you need and keep your house safe and all that good stuff. Hey, we got 2 minutes left, Stephanie. And since you called from Texas, where do you want to go for 2 minutes?
Where I want to go for 2 minutes is to remind people that we're grateful to KHTS AM 1220.
Of course.
For close to 12 years for offering us a platform to talk about the things family members need to know to be happy, healthy, and caring and raising their children in that process, because it takes a village.
It really does, and I'll tell you what, here in Santa Clarita with KHTS, Action, the school district, the sheriff's department, the city, we have a pretty darn good village, don't we?
Hey, you know what? One thing I wanted to throw out there, and I know Stephanie is going to agree with this, you're going to agree with this, Cary. We have an unsung hero here in the studio who's with us every week when we do this show, Justin.
Oh, yeah,
Your board operator.
Yeah, our board operator. Take a bow, sir. There you go.
Wow.
Take
We're
a
embarrassing
bow.
him, but if it wasn't for him, we would just be sitting here talking to ourselves because he wouldn't
Do you
turn on the microphone.
do you have a sunburn, or you're blushing? Will you pay attention to the camera, please? Yeah, there you go. Thank you.
But it's true.
I know
He's
it is.
part of the team.
No, we could not do it without him. I could not sit back there and do that.
Oh, we wouldn't know how to punch the buttons.
No, I'd be lost. And he does a great job. So thank you, sir. We do appreciate everything you do. So, Stephanie, thank you for all you do. We appreciate
You're
that
welcome.
in helping us in this real war that we're fighting when it comes to our young people and substance abuse in our country, and especially here in Santa Clarita. And you know what? I'll tell you what, and sometimes it don't feel like it, but we are making a difference.
We sure are. And while we're talking about it, think about the theme, again, for the Recovery Month. Join the voices for recovery. Visible, vocal, valuable. This is good stuff.
It's great stuff. It's great stuff. Hopefully we can drop that number from 43,000 or 350 deaths a day.
Can you feature the visual of 2,411 tons of drugs that were collected? Can you feature that visual?
Yeah, I can actually.
That's a huge mountain.
Yeah. Can you feature the amount of lives that are being saved?
That's a lot of
It's time
pills.
to wrap this up. It's Recovery Month. I'm glad that we were able to do what we're doing. Stephanie Weiss, thank you for calling from Stephanie from Texas. And hey,
Yeehaw.
till next week, this is Families in Action on your hometown station, AM 1220 KHTS.